Dear students, let us continue with the methods of assessment of bioavailability. And the last method is therapeutic response method or clinical response method. Theoretically, the most definite this method is based on observing the clinical response to a drug formulation given to the patient suffering from a disease for which it is intended to be used. Okay, so this method has some drawbacks. Okay, they are quantitation of observed clinical response or therapeutic response is too improper to allow for the reasonable assessment of the bioavailability between bioavailability of a dosage form or the bioequivalence between two dosage forms of the same drug. Bioequivalence studies are usually conducted using a crossover design in which each subject receives each of the test dosage forms, and it is assumed that physiological status of the subject does not change significantly over the duration of the study. And unless the multiple dose protocols are employed, a patient who required the drug for a disease would be able to receive only a single dose of the drug every few days or perhaps each week. I repeat once again, unless multiple dose protocols are employed, a patient who required the drug for a disease would be able to receive only a single dose of a drug every few days or perhaps a week also. Many patients receive more than one drug, and the results obtained from a bioavailability study could be compromised because of a drug-drug interaction. Okay, so because of these considerations, the general conclusion is that most bioavailability or bioequivalence studies should be carried out in healthy subjects. However, for drugs which are not designed to be absorbed into systemic circulation and are active at the site of administration, clinical studies in patients are the only choice to determine the bioavailability or bioequivalence. Such studies are usually conducted using a parallel design rather than a crossover design. And examples of such studies are administration of topical antifungal agents, drugs used in the treatment of acne, and drugs such as drugs used in the treatment of ulcer, etc., etc. So this is about the assessment of bioavailability with clinical response method or therapeutic response method. So it is very rarely used. This method is generally not used because of its drawbacks, and it is very rarely used, and is most suitable for drugs meant for topical administration and local action, and not for systemic action generally. So with this we have completed the methods of assessment of the bioavailability, and we have also completed the topic bioavailability and bioequivalence. And I will be okay. Apart apart from all the videos I made and that I will going to be posted into your group, I will also post the material that I have into your group, and I'm asking you to refer to the material that I will post into the group while you are listening to the videos that I will be posting. So the tables, formulas, and the graphs can be referred to. The tables, formulas, and graphs present in the material should be referred to while listening to the videos for the purpose of understanding. And this is all about the last topic, bioavailability and bioequivalence. So with this we have completed our syllabus, and I wish you good luck for your exams, and thank you.